All right, welcome everyone, and thank you for all coming out to the Emergency Operations Center today. We're here because 2 weeks ago I signed an executive order declaring the opioid epidemic a disaster, and I called on members of our administration to take a new approach to address it. This crisis is the worst public health epidemic I've seen in my lifetime. It's killing more Philadelphians than AIDS at the peak of that epidemic. Countless individuals are suffering from substance use disorder, and it truly breaks our hearts to think about what they're experiencing. Similarly, opioid addiction has driven up the number of individuals suffering street homelessness. In summer of 2017, there were approximately 900 unsheltered individuals in Philadelphia, 400 of whom were living on the streets of Kensington and Fairhill. By summer 2018, this rose to approximately 1,400 unsheltered individuals, 700 of whom were living in Kensington and Fairhill. This crisis has created unacceptable conditions for Kensington and the surrounding neighborhoods. Drugs are bought and sold. Addiction has led to prostitution, and our streets, schoolyards, and parks are littered with trash, human waste, and used syringes. Our kids, residents, and commuters dodge illegal activity on their way to school and to work. Many are unable to take advantage of the playgrounds and public spaces they should be able to enjoy. I've heard their concerns at community meetings, and they reach out through letters, emails, and social media. Believe me, they're frustrated, and for good reason. Despite the vast efforts and investments by the city, it's become apparent that our current approach is not working. We must take on a new strategy to tackle these complex issues. New partnerships must be forged and new resources must be brought to bear. So every day over the last 2 weeks, our Office of Emergency Management opened this Emergency Operations Center to representatives of dozens of city agencies, departments, and offices. Under the leadership of the Managing Director's Office, participants have been sharing information, identifying existing resources, analyzing where we have gaps, and organizing our new emergency response. It's an effort we're calling the Philadelphia Resilience Project, because Philadelphians have proven time and time again that we're resilient and there's nothing we can't overcome. We're a city of neighborhoods that look out for one another. As I've said many times before, there are no throwaway people. We owe it to our fellow Philadelphians to do everything we can to tap into our resilience and overcome this crisis once and for all. Now I'd like to acknowledge Mike DeBerdinis, our Managing Director, Brian Abernathy, First Deputy Managing Director, and Noel Foysen, Acting Director of OEM, for their leadership, as well as every participant in this activation. I also want to acknowledge Councilwoman Maria Quinones-Sanchez, who is here, and Councilman Mark Squilla, who is on his way, who have been vocal advocates and change agents for their districts. Oh, he's here. We could not do this work without them and their staff, and I sincerely thank them for their partnership in this new endeavor. Now I'd like to ask Councilwoman Sanchez and Councilman Squilla to come up and say a few words.
Thank you. I want to publicly thank the mayor on his leadership in ensuring that not only are we working hard as a city to address this, but that we work smart. And part of working smart is what takes place in this room every day as departments figure out a way to better leverage the resources that we have on the ground and better partner with the community folks on the ground who are incredibly frustrated with what has happened. An occupation is not a tolerable situation. People homeless, living in the streets is not a tolerable situation. And I believe that while government cannot resolve all of the issues, we owe it to the long-term residents trapped in this national crisis to try to do a better job. To do a better job means, one, as the mayor said, an acknowledgement that working in silos is not going to address the situation. That working in silos and not respecting the public safety and the children and the seniors who are trapped and walk through this every day is not acceptable. So to the Managing Director's Office team, Brian Abernathy, Tumar, and all, I appreciate it. Mike D for his efforts for the last 2 years, who's been on the ground with us. What I most appreciate about this effort is what doesn't work gets fixed, and if we have to start all over again, we will, because that's what the residents of Kensington and Fairhill deserve. A government that is nimble enough to acknowledge that this task that is all across the country, that we are going to address this and try to make things work. And every day, the quality of life of those residents has to get a little better. And that is the goal. Thank you so very much.
Thank you, and I want to agree with my colleague, Councilwoman Sanchez, who has been at the forefront of this with myself out on the streets and talking to the neighbors, the residents, and the folks also under the tunnels and living on the streets of Kensington and Port Richmond area. I too want to thank the mayor, the administration, the MDO's office, Mike D., Brian Abernathy, for willingness to listen to us and work with us on this. And we don't always see eye to eye on every issue, but it's important that we feel like our messages are being heard and our messages that we're carrying from the community to the administration. This is not an easy task when you have collaboration by a whole bunch of different departments working with mainly the police department, the MDO's office, even outreach, and other independent bodies. It gets complicated, but knowing that the administration, the MDO's office, and the mayor is willing to work outside the box to come up with other ideas on how to approach this situation. As you heard Councilwoman Sanchez say, how the neighbors are being affected surrounding this epidemic, and how the people that are actually living in the streets that are a part of the epidemic, how can we do a better job both to help them help themselves, but also help the neighborhoods that are suffering from this. And I know we're talking about Kensington, and Kensington is the epicenter of this, but this is a citywide problem. This is not just in Kensington, it is throughout the city of Philadelphia. And we need to look at all aspects of how the city could work together and learn from this. We know that things that we try may not work, but we're trying them. And I think that's the most exciting part. We're trying something different. We're looking at ways to make it better. For both the people that are on the streets and for the people affected, surrounding it. So I got to give, again, the administration a lot of credit for willingness to do this. And I know that if we do this together, we will make a difference. Again, like Councilwoman Sanchez says, if there are things that we do try that do not work, then we'll try something else. And if there are things that we try that do work, we'll implement them in other areas also. So I'm proud to be here today working with all of you and to understand that this is just a start. It doesn't solve any problems, it doesn't fix anything, but it's a start. And we're going to use any aspect that we can, any criteria that we need, and any other idea that anybody else has that think that we'll listen to implement in this situation to make this better. So thank you.
Hi, good afternoon, everyone. I'm Mike DeBerardinis, Managing Director. Over the past 2 years, the city has worked very hard on issues facing Kensington, in particular in the city in general, relative to the opioid crisis. The mayor has convened an opioid task force, and we're currently acting on recommendations of that task force that would improve treatment options and limit the availability of prescription opioid drugs. We have spent tens of millions of dollars on police, EMS, behavioral health services, increasing shelter beds, Narcan distribution and training, clearing several encampments, picking up needles, clearing short dumping sites, sealing vacant properties, cleaning graffiti, and the list goes on. We have worked very hard to listen and to work closely with community organizations and residents to respond to their concerns at the same time as we try to move people into treatment. Despite these efforts, the challenges in Kensington and surrounding communities, hundreds of addicted and homeless, thousands of discarded needles, unsanitary living conditions, and an environment that no one should be forced to live in still persist. This requires collaboration and coordination. Our response requires collaboration and coordination on the city's part and bringing more stakeholders to the table. 2 weeks ago, we activated our Emergency Operations Center, and our Office of Emergency Management has been utilizing its experience in handling emergency relief efforts to organize the city's new response to this crisis in Kensington and the surrounding neighborhoods. I echo the mayor's gratitude and concern to Brian Abernathy, who has led this new effort, to Noelle Foysen and her team for taking this challenge up and applying their emergency management principles in new ways, and have facilitated productive conversations to help us develop a new path forward in the next couple of months. Noelle is going to take us through the rhythm of our day-to-day operations here and what they're doing to mount this new effort. Following Noelle, Tumar Alexander, the MDO's day-to-day lead in this effort, will walk through the goals and priorities that have been established for each of the 7 mission areas. Again, Tumar, thank you for accepting this new responsibility, and Brian, thank you for your excellent leadership in mounting this effort. So, Noel, there you are.
Hi, I'm Noelle Foisen. I'm the Acting Director of the Office of Emergency Management. We activate this room, the city's Emergency Operations Center, or EOC, to coordinate city services and emergency response during snowstorms and Super Bowls. The EOC brings together decision makers and allows for face-to-face problem solving to ensure our response is smart and decisive. The EOC model cuts through red tape and allows for quick action and course correction. For the past 2 weeks, we convened daily meetings to support the 7 mission area leads identified in the executive order. During that time, the EOC has hosted nearly 70 individuals from 35 city agencies, departments, and offices. We have spent this time finalizing immediate, short-term, and long-term goals for each mission. Immediate goals should be completed within 4 weeks. Short-term goals will mark the end of the 90-day period in the initial executive order, December 31st, 2018. Long-term goals are defined as those expected to be completed within 3 to 9 months, which is June 30th, 2019. Now that these goals have been identified, the EOC will move towards a more regular schedule with Monday and Friday all-hands meetings, including executive leadership, and Tuesday through Thursday focus on project-specific planning to accomplish our goals. The Philadelphia Resilience Project is a marathon, not a sprint. Tumar will now walk you through the 7 mission areas and their immediate, short-term, and long-term goals.
Hello. My name is Tumar Alexander, Deputy Director of Intergovernmental Affairs for the Office of Managing Director. I'm going to ask our mission area leads to join me up in front, please. Thank you. The executive order references 7 missions. Mission Area 1, cleaning major encampments, which is led by Beverly Woods of the Managing Director's Office, Health and Human Services Cluster. Beverly, just put your hand up. Thank you. Mission Area 2, reducing criminal activity, led by Evangela Manos, Managing Director's Office of Criminal Justice and Public Safety. Mission Area number 3, reducing the number of unsheltered individuals, led by Liz Hirsch, Office of Homeless Services. Mission Area 4, reducing trash and litter, led by Tom Conway, Community Life Improvement Program. Mission Area 5, reducing overdoses and the spread of infectious diseases, led by Dr. Carolyn Johnson, Philadelphia Department of Public Health. Mission Area 6, increasing treatment options, led by Sandy Vasco, Department of Behavioral Health and Intellectual Disability Services. Mission Area 7, mobilizing community resources, led by Damaris Feliciano, Managing Director's Community Clusters Office. Allow me to highlight some of our goals. The complete list of goals will be given out at the completion of this press conference. Mission Area 1, immediate goal, clear Frankfurt Avenue encampment by November 15th, prevent the formation of new encampments on all vacant properties near the Frankfurt Avenue encampment and surrounding areas. Short-term goal, begin outreach to clear Emerald Street encampment by January 15th. Long-term goal, working with partners to develop strategy with stakeholders to prevent encampments from relocating or reforming. Mission Area number 2, reduction in criminal activity. Immediate goal, increase safety measures for children using foot and bike patrols and daily school checks. Create and strengthen existing safe corridor routes for travel to and from schools in the area. Implement police-assisted diversion program in the East Police Division. Short-term goal, enhancing federal and state partnerships to address narcotic supply and distribution. Long-term goal, create and strengthen safe mass transit corridors. Mission Area 3, reduction in unsheltered population. Immediate goal, identify a temporary site for a 24-hour navigation center, including respite and wraparound social services. Short-term goal, explore immediate housing, inspired by Seattle's use of the tiny house village model. Long-term goal, examine affordable housing strategies that include family reunification and employment assistance. Mission Area 4, immediate goals, conducting a large-scale community cleanup along Kensington Avenue on Friday, November 2nd. Placement of needle disposal containers at McPherson Square and targeted septic stations. Provide a temporary dumpster to support Frankfurt Avenue encampment closure. Recruit volunteers with lived experiences to assist with regular cleaning of the neighborhood. Use bicycles for mobile collection of discarded syringes. Long-term goal, pilot mechanical street cleaning program on major arteries in the Kensington area. Mission Area 5, reduction of overdoses and harm reduction. Immediate goal, prevent the transmission of HIV and hepatitis by screening, vaccination, and linking to medical care. Short-term goal, increase distribution of naloxone and related training to the community and public agencies. Long-term goal, implement opioid fatality review process. Mission Area 6, disseminate information on all treatment capacity access. I'm sorry, let me go back. Mission Area 6 is increase medical assisted treatment to the community. Disseminate information on all treatment capacity access. Deploy mobile outreach teams, including medical professionals, to provide medication assisted treatment. Short-term goal, expand warm handoffs between emergency departments and treatment options. Mission Area 7, mobilizing community resources. Create a community calendar to encourage neighborhood engagement by highlighting programming across all mission areas. Identify potential funding partners. Create and train Philly 311 unit for specialized Kensington, Fair Hill information and assignments. Long-term goal is to build strategies for citywide awareness and engagement around the opioid issues. Like I said, we'll release the fuller list of all of our goals, both immediate, short, and long-term, at the end of this press conference. All of these folks standing behind me today has put a lot of work and a lot of effort, along with the agencies that Noel mentioned, to come up with these goals. This is something we're very proud of to help the residents of Philadelphia. Thank you.
Thank you, Tumar. I'm Brian Abernathy. I'm the first Deputy Managing Director. The work that these teams have done in the last 8 days has been significant, and the goals they laid out were ambitious, and the information that we just provided was a lot. Teams have worked with multiple agencies, reported to multiple executives, received feedback from community organizations. As we move towards implementation, that work will continue and we'll make adjustments as needed. All of our work will be reported weekly at phila.gov/opioids, and we've created a community advisory committee to help make sure we're defining success in a way that makes sense not just to government, but that makes sense to the leaders and the communities that we're trying to serve. What has struck me most about the work we've done over the past 2 years, and what has been reinforced over the past 2 weeks, is how strong this community is. These community members love their neighborhood. They support one another. They have found strength where others have found desperation. And how strong our staff has been. No other police division faces the types of issues that East Division faces. The courage that librarians have shown in reversing overdoses, the hope that outreach workers and doctors bring to those suffering with a horrible disease, and the determination of sanitation workers and CLIP staff as they pick up tons of trash and clean dozens of vacant lots again and again. These men and women are pushing a rock up a hill only to have it roll back on them every day, and yet they keep on pushing. They are the best of our city, and our city must do best by them. These men and women have defined success by helping one person at a time, cleaning one lot at a time, supporting one neighbor at a time. They've had to define success that way because the issues they're facing are so overwhelming and our systems are being crushed. We should all be inspired by the resilience of our staff and of these community members, and we must also remember to have a clearer vision of success. Our children must be able to walk to school safely, to be able to play in parks, and to be free of needles. Our seniors must be able to sit on their front porch, that they don't have to clean human excrement off before they sit down. Business owners should be able to open their stores without dodging sleeping bodies, and those suffering with addiction should be able to find help and support and housing. The work our staff, our leaders, and our communities have done to date has been amazing, but the struggles we're facing are still significant, and we will not be able to face those struggles alone. We're calling on our philanthropic partners, members of the business community, religious organizations, civic associations, and nonprofit organizations, residents, concerned citizens, and service providers to support Philadelphia's Resilience Project. Help those that suffer from substance use disorder survive their disease. Help families stay strong through some of the most trying times of their lives, and help our community, our neighbors, endure and overcome the conditions that they struggle with every day. And I hope that we all can remember and learn from what Kensington's resilience really has been. At this point, we're happy to take your questions.
Here's a question for the mayor. When you put your hand on the Bible in 2016, this issue was happening in Kensington. You're 3.5 years in, Mayor. Why did it take you so long?
Well, first of all, the issue was not as exacerbated as it is today. We've basically doubled our homeless population in the last year or so. So we were addressing the problem as best we could. We recognized that it was billowing out of control, and now we're taking another approach. This is not easy work, and this is not an easy situation. This is a situation that's been created by the pharmaceutical industries who told people that these drugs were not addictive, by unscrupulous doctors who overprescribe, and people have been in the clutch of this problem. It's got nothing to do with my hand on the Bible, trust me. It's got to do with getting the work done, and we're doing it. And to acknowledge the fact that this issue has doubled, at least doubled in the last year. So it wasn't as bad as it is now, and we're addressing it. There's nothing else I can do but address it, Bible aside.
Well, Mayor, if I could follow up on that, what is your vision of success? I mean, I know that
Success is the
currently-
reduction of death. Reduction of death. Now, you can hear what you want to hear from the federal government about supervised injection sites and other things, and people get locked up and all that. I wish they were as concerned about people dying. We are on the route again to at least probably 1,200 or so opioid deaths this year. And my definition of success is less death. Less death. And that's the first issue. The second issue is kind of putting this neighborhood back together again so that people can feel comfortable in their own homes, their children can walk to school. We did not ship heroin and opioids into this neighborhood. We are trying to push back from what has been foisted upon us by other factors because of greed. And that's all this is about. Our gun violence is about greed because no one wants to stop selling guns. And our opioid addiction issue is about greed because these docs and these companies won't stop pushing this stuff on our people, period. I had surgery 1.5 years or so ago. I walked out of the hospital with 30 oxycodones. And I asked my doctor why. Why do I need this? I think I used 4. And then I went to Tylenol 800 milligrams, and I was fine. We're doing the best we can.
I have a question about the encampment.
Yep. I'm sorry. Here we go.
Last time the city cleared the encampments at Kensington Avenue and Tulip, there was a lot of preparation work in advance. The November 16th deadline is coming up fast, you have less than a month. Have there already been preparations underway? And also, the new navigation center, will that have 4 beds for this building?
So yes, outreach and recruitment never ever stopped. It is part of the city's infrastructure, but yes, they have continued to do outreach throughout Kensington as well as those hot spots, including the encampments. And we recently transition those who were in our Kensington Nav Center into other housing. Each of them has housing plans so that we could empty out that facility to have a place for people who are leaving the encampments to be.
So how many beds, emergency beds are in it?
40. There are not emergency beds in Kensington, 40 beds available in the Navigation Center, which was specifically put into place for the encampment closures.
And there's a new navigation center opening up on the 16th?
There is the same navigation center that we opened for the original encampments, and the people who are in that navigation center have housing plans, so they have moved on into other housing, and so we essentially emptied it so that we would have a place for 40 people leaving the encampment on Frankfurt Avenue.
Okay, so there are 40 beds for
Yes.
all of those 30 people?
Yes, at least 40 beds at that navigation center.
Thank you.
Sure.
Other questions? Aubrey?
Can you just say, obviously this has been going on for a while. Bad as it is now, this has been a source of tremendous frustration for neighbors for a really long time. Can you talk about convincing them that this will be the one that works?
We met with a number of the community leaders earlier this week, and I think, I don't want to speak for them, but I think they're cautiously optimistic. I think the work that we're doing, and I want to commend the managing director. I think the work he has led over the last 2 years has been significant. And if you, it's literally tens of millions of dollars. And if you include FY19, it's over $30 million in 2 years in one community. But clearly we haven't been doing something right, and so it's time to adjust. I think the teams that we've put together, the cross collaboration, the ability to move nimbly, quickly, to be able to fail fast and to recognize those mistakes and move forward, and the accountability that we're building into the system is something that I think has given residents some comfort. It is a different approach. It is taking everything that all of our different departments are doing and putting it through one chain of command in a way that people can easily see, and we can easily identify gaps. And that's the intent of incident management. And so, honestly, in 3 months, I might turn around and say, well, hell, that didn't work, and let's try something new. I believe this is the right path forward. I believe that we're going to see success. But if it's not, to Councilwoman Sanchez's point, we're going to try something new. What has happened in Kensington, and what we as a city, not just city government, but we as city leaders have allowed to happen in Kensington, is wrong. We have to uplift that community if we're going to continue to lift up Philadelphia. We have to figure out how to solve the problems that Kensington is facing, because it is endemic and systemic through the rest of the city. And I'm confident that this city and this administration is determined to figure out how to solve those systemic problems. Other questions? All right. Thank you all very much.
Thanks.